what I want to talk about now a bit is a bit about the background to mental health. I know we have a lot of different disciplines and regional representation here as well. And I think it's interesting just to start with the basics of what we mean by mental health. And even the term mental health can be considered sensitive, or even the stigmatizing nature of the word mental, for example, is in itself an issue to some psychologists, for example. I used to have a supervisor that said, stop saying mental health. It's not mental health, it's well-being. And then when you get into the well-being literature, you'll never find a polite consensus on the definition for well-being, although maybe some people will disagree with me on that. But it's a complex area. The WHO, for what it's worth, says mental health is more than the absence of mental disorders. So it's an integral part of health. So there's no health without mental health. And there's various determinants of this, whether they be socioeconomic, biological, or environmental. So that's very broad. I have encountered throughout various kind of European networks different operationalized understandings of mental health. So, for example, that there might be clusters of sometimes institutions or sometimes professionals that might simply understand mental health to be a set of problems that people experience at different times. And I think when we talk about researcher mental health and the particular unique needs that researcher mental health brings with it, I think you'll see that these definitions can be problematic because there's lots of cultural issues, career development issues, competitive issues, funding issues, as they intersect with being a human, whether that's having work-life balance issues, going through life transitions, changing locations. And this doesn't even speak to any other kind of maybe predisposing risk factors as well. So the more you try and define it, the more complex it can get. So I think it's just useful to have this framework, at least from the WHO, to inform our understanding. The WHO does go on to talk about, specifically within the action plan from 2013 to 2020. I'll just read it for you here. So mental health is conceptualized as a state of well-being in which the individual recognizes or realizes rather his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. With respect to children, an emphasis is placed on developmental aspects, having a positive sense of identity, managing thoughts, emotions, and building social relationships and the aptitude to learn and acquire education, ultimately enabling full active participation in society. So again, you can see that broad definition is expanded a bit there as well. So I think keeping all these factors in mind and that kind of broad scope of a mental health or mental health and well-being definition is important for this action, not least because you will all encounter different labels, different definitions across the different levels of institutions within Europe. Some of the research backdrop to this area as well. A lot of you will have your own familiarity with the different areas of the literature. We'll focus on just a few of them here today. But suffice to say, there is an increasing stream of evidence which is pointing to there's been a lot of research on student mental health, PhDs, postdocs, which then I think informs early career researchers as well. Organizational context being the key predictor here of very often poor mental health outcomes. There's been a few seminal studies which we'll talk about as well, but among the factors that are most interesting here is that there are particular factors of academia and research culture that are themselves predictive of poor mental health outcomes. The first, have I skipped a slide? Sorry, it's some policy backdrop as well, which is very important, and some enduring issues that occur across regions and very significantly as well would be stigma and that misperception about what mental health is, and that relates, of course, to the the problems with defining it and labeling it and talking about it. This is not just related to academia, but to other working areas as well. Which is why the prevention and awareness awareness building is so important. And of course, a cost action in itself is a networking initiative. So that's a really key component that we can all talk in the same language about the same problems. Some of the seminal studies in this area that you may or may not be familiar with would be Katia Levesque and colleagues. So this was a large-scale study from Belgium showing a really high prevalence of, in this case, PhD students, 1 in 2 PhD students experiencing psychological distress, whereas 1 in 3 being at risk of a clinically significant psychiatric diagnosis. This was seminal at the time, not least because of the scale and the representativeness of the problem, and really kind of unmask what a lot of people in academia were aware of, which is a high prevalence, perhaps disproportionately so, of mental health problems. And you can imagine what the scale of a problem would do when these PhD students get to, for example, early career, either researcher level or perhaps industry based. Susan Guthrie and colleagues as well have produced a rapid evidence assessment, 2017 this was, and I suppose this was looking at the well-being levels of different staff, the majority of staff finding and certainly reporting high levels of stress and producing different risk factors, PhD students as well, different demands that are conflicting and producing poor work-life balance outcomes, that sense of control, that loss of control that individuals have, poor support from supervisors. This was another key theme within the Levesque study, which is how supervision and different styles of supervision can be predictive of different outcomes. Whereas in contrast to different areas, academics appear to be not disclosing mental health problems. So this is another area which prevention and awareness building can specifically target, and different areas where we're seeing different outcomes across networks. Furthermore, job security is a huge issue as well, as we know within academia. Also highlighted by the WHO, and indeed in this study, is that gender, there's different gender issues as it relates to higher prevalence across different regions in Europe. Another thing I'd flag as well, you'll see different language here as well, you know, stress, for example, poor well-being. So again, different kind of job satisfaction as well. Sometimes this kind of career development or professional kind of language or policy speak is very different to maybe personal mental health crises, for example. So there's a lot of, I suppose there's a lot of interaction there as well. Sometimes the universities are criticized for seeing mental health as singularly an issue to do with productivity. So if your mental health is adversely impacted, you can't be productive in the university environment. Whereas if we go back to our definition from the WHO, we can see that it's a lot more complex. If you're only looking at mental health so you can make the person more productive, then that's part of the problem. So we need to be aware of that. But nonetheless, that's those specific environmental variables such as stress and job satisfaction is a key problem within the evidence as we understand it. And of the interventions that are out there, the evidence is limited as it stands. A couple of suggestions that are emerging in the literature as well. I'm going to mispronounce Inge's name here. I think Inge is joining us. I'm so sorry, Inge van der Veegen. You can criticize me later. I'm very sorry. I did actually.
No problem.
Please pronounce it. I'm very curious.
Inge van der Weijden.
Okay. I used to have a Dutch colleague who sat beside me and laughed at me every day for mispronouncing some Dutch words.
No problem.
So sorry. So yeah, I suppose these suggestions are always interesting when we talk about the complexity of the problems, and it always begs the question, well, what can we actually do? So these suggestions are particularly good as a starting point. So appointing an independent psychologist for PhD candidates, a supervision team for international candidates. This is particularly interesting in a European context where there's where funding is predicated on people having to move across borders, which brings with it a whole set of issues. Career coaching and transferable skills, and not just for academic careers. Supervisor training, I think this is a huge one as well, where if we have a more sophisticated understanding of researcher mental health issues, that supervisor training should therefore be impacted by this at a duty of care level, given the risk factors that we know about. Transparency, that's certainly something that's needed across different levels, or different hierarchies and different levels. Independent mentoring groups, I'll talk a bit about that as well. And different monitoring. There were some questions as well that we discussed in our breakout groups about how do we actually monitor this? We're all academics in some shape or form, so how can we actually use data to further these conversations? And this will be a key component of what's called the evidence hub within the overall cost action. Something that we can use that will that we can contain and build evidence that lives beyond the project life cycle. And also how this can relate to the construction of and the evaluation of different interventions. So there are some of the things that we can do. The overall aims, I suppose, of this working group, at least as we proposed them, was linking actors that deal with developing and promoting sustainable and enjoyable research climates. I suppose when I think about that, I think about the various initiatives that I've seen, whether they be official or unofficial, sometimes led by clusters of researchers or students, sometimes outside the university space. These can be campaigns that are even sometimes it could be a call out culture. It could be a support group driven by social media, different things where they're calling out the sometimes toxic research cultures that are directly impacting the mental health of their colleagues. A further aim, provide deep insights on the determinants of sustaining employment and long-term integration within workplaces. And finally, focus on matters such as counselling support, peer-to-peer support, and online networks. I think the online networks component is particularly important as we consider the challenges that are still enduring from the pandemic and what that has done to different individual and group interaction. Furthermore, addressing mental health at a local actor level, what the challenges are and how they can be addressed. An evidence-based understanding as to what best practice looks like at a local level. Sharing and promoting local level experiences for effective assessment, intervention, prevention efforts for researcher mental health. Local actor, like there's a lot of cross-cultural variability, particularly as it relates to this issue. Best practice in the UK and Ireland is probably very different to other parts of Europe. So being able to try and understand what's working well in different areas, and also trying to gauge an understanding as to what's going on out there. I know there are lots of different innovative cultural practice changes occurring, but I also know that a lot of people don't know about them. So I'm actually hoping to explore that a lot more within this working group, and leveraging all of your experiences as well to try and build and feed into that. I'll just briefly talk a bit about one perhaps ground up initiative that I thought was interesting in the context of this working group. So this was a mentoring initiative that myself and a colleague established within our roles in a task force within the Marie Curie Alumni Association, MCAA. So we were kind of exhausted by all the policy documents and macro level discussions about mental health, but nothing really being done. We've all been to that meeting where we talk about the amazing research and the policy ideas, and a meeting about a meeting about a meeting about a meeting, and then nothing happens, and we kind of all go away going, you know, what can we do? So from that, my colleague and I thought about, well, mentoring is an established career development strategy. It's seen in many areas of life and in many industries. Is there a way that we could kind of blend that with your standard peer-to-peer support that we see in mental health spaces? And could we do that within the MCAA and some of the networks in there, maybe working with local European chapters, for example. So that was simply something where we use what we did within one of the General Assembly meetings. So we looked at a dedicated session to mentoring, and we looked at the mental health session of researchers, and we kind of combined some of the inspirations from this to produce Reverent, which was a pilot initiative whereby we matched early stage researchers, our students, with senior members within that network. And we're currently evaluating that as we speak and launching the second round of it. So that was just something that we were keen to do, so we could support people that needed support today and tomorrow, rather than waiting for institutional level change or policy level change, for example. So I just thought I'd share that as one example of perhaps a ground up initiative. So I've bombarded you with research examples, I've bombarded you with policy speak and lots of ideas and definitions. I suppose as all this relates to this particular working group, I thought it'd be an interesting exercise to do a basic SWOT analysis. So when we consider this working group, what are the strengths, weaknesses, opportunities, and threats as you see them, based on this presentation, based on the conversations that you have had within your working group as well. So I propose that we use Padlet for this exercise. Padlet, we'll pop that in the chat as well, which Brian has done. Thank you, Brian. So Padlet will allow us to kind of list within each of these columns the strengths, weaknesses, opportunities, and threats. So what I propose we do is, if we take 15 minutes, and then we'll regroup after that just to reflect on the collective input across these different columns. So that is in the chat there. If there's any issues with that, just let us know in the chat and we'll sort you out, but that link should work. And you should all be able to just click on the column and input what you see as the strengths, weaknesses, opportunities, and threats. So feel free to turn off your camera, take 15 minutes, and we'll regroup then.